Good afternoon, everyone. Hi, I'm Katrina Otto. Welcome to our webinar, Comparing AI Tools for Clinical Practice. Today's webinar is very exciting and we have a lot of people joining in. We're going to take you on a journey comparing AI tools. Now, this is a big ask, a big webinar, and I am surrounded by a wonderful team of experts. I'm going to be joined by Matt from MediQo, Barad Azadi, a cybersecurity expert, and Dr. Riaz Hashimi. If you attended our previous webinars, you would have had the privilege of hearing how he's finding some of the AI tools helpful in his general practice. So I would like to acknowledge the traditional custodians of the lands and waterways in which we're all meeting today and pay our respects to elders past, present and emerging. I'd like to extend a really warm welcome to all of our Aboriginal community controlled health organisations and AMSs who are joining in, and welcome everybody, and thank you for sharing your time with us. Today's webinar is going to be an exploration of AI tools that you might want to consider implementing in your practice. Matt's going to give you a live demo of a few tools. If you have not met me before, I am a medical director and best practice trainer. I introduced medical director and best practice with my wonderful colleagues 20 years ago and have been introducing and teaching the third-party programs that have come along since. So today's session is going to be learning about what tools are on the market at the moment. It very much reminds me of 20 years ago when we had that introductory session for medical software and there was 23 products on the market and it all felt a bit like this. There's a lot, it's confusing, it's overwhelming. The difference is you all know a lot more now because you're used to introducing technology, and also it's very similar because it's like, what questions do we ask? How do we know if it's secure? Lots of consideration, which we have factored into today, and we'll leave you with a guide, side-by-side comparison. We'll talk about cost. This is going to be current for 5 minutes, just so you know. AI is moving fast. I really want you to hear from Brad because he is got insights into security, patient practice data, and I really encourage you all to look at this. You can't half tell I'm a practice manager, but look at this as a quality improvement activity. Like, I want you to consider, what are your biggest pain points? Look at all the tools. What could you implement that's going to bring benefit to you, your practice, your clinicians, your patients, and then measure whether that change was an improvement. So we're going to leave you with how you can access the tools. If you can't stay for the whole time, there'll be a recording. And please use the chat panel to ask questions. I won't look at it at the moment because I'll be focused here. But if we don't get a chance to answer your questions in the webinar today, we will get back to you. Now, please know that Matt's going to talk to you and offer you a demo with him. Take him up on that. That's where you can get all your questions answered. I just learnt you could ask for a Katrina discount, so do that. And the learning outcomes today is, I'm a trainer, it's important. Introduce this into if you're in a practice, introduce this to your team, discuss it, be risk savvy, not risk adverse, and tick 2 boxes at once. There's your CPD. So AI tools in healthcare. Now, if you attended our first webinar, which was AI Beyond Scribes, look how quickly we moved beyond scribes, right? So if you didn't catch that one, go back and watch it, all the recordings and all the resources that we create for these monthly webinars. They're all free for you, thanks to MediQo. And these are just some of the options that you can consider for your practice. And AI, and I take my feedback from what the practices tell me. AI is making it's what's that overused word already? Game changer. It's a game changer. Personally, I've seen AI scribes as a game changer for doctors, but from my practice manager consultancy perspective, I needed to break it down into pre-consult, consult, after consult. What are all these tools? Who are all the players in the market? I needed to compare apples with apples. So if you didn't listen to the first webinar, I created this for my e-learning course, AI literacy, because AI literacy is a fundamental skill for practice managers these days. We need to understand all of this, what the risks are, what the benefits are, how to introduce it. So again, I don't want to overwhelm you. Today's going to be your big session. I want you to be thinking, what is our biggest pain point? Now, clearly, for a lot of doctors, it was time with their patients, being able to look at their patients again, and it's also having improved clinical notes. So the scribes was a win. For a lot of my practices, managing this scanning and the inbox allocation has been a big win. Answering the phones. What is your biggest pain point? And like we do with all of our practice improvements, choose one, start small, trial some products, then evaluate, introduce it to your team, get feedback from your stakeholders. Now I'm going to hand you over to Matt because this is the fun part where you get to see and listen to a bunch of different tools today. And I will have a bit of a look in the questions as well, and I'll come back to you later.
Thanks, Katrina. Hi, everybody. My name's Matt. Today, we'll be running through the similarities and differences of some of the clinical AI tools available in the Australian market currently. And we'll start with AI receptions. Across all clinical practices, AI can now be used to book patient appointments, so your human receptionists don't have to. So this means that you can answer the phone after hours, on weekends, and when the practice is busy. In MediQo, you can answer frequently asked questions. The AI can also complete pre-consult triage, so you're not booked for a 10-minute consult if you need 30 minutes. You can speak more than 130 languages, and the AI can take up to 50 calls concurrently, so you never miss a booking call. Now, it also means that patients who need to speak to reception are able to because the phones aren't constantly ringing, which allows for a better patient experience and happier staff. You can ask to speak to a human receptionist at any time if you need to, and it will transfer you straight through. And when the appointment's booked, it'll show up in MediQo and in your PMS. It automatically syncs. Now let's have a listen to some examples of AI receptionists, and we'll start with MediQo.
Hello, this is Jess, MediQo AI assistant. I can talk in other languages too if you prefer. How can I help you today?
Hi Jess, could I book an appointment please?
Sure. What's the reason for your visit so I can choose the right appointment type?
I've got a sore throat.
Thanks. Since a sore throat can be contagious, a telehealth appointment is often a good option if you're comfortable with that. Do you prefer telehealth or an in-person visit?
I think in person would be fine. Have you got a female doctor?
Yes, Dr. Emily Carter is a female GP. Would you like the first available appointment with Dr. Carter?
Yes, please. What time is that?
The first available with Dr. Emily Carter is tomorrow at 9:10 in the morning. Would you like to book that?
That sounds good, thank you. I'll book at 9:10 a.m. Is there parking nearby?
Yes, there's parking right out the front. Can I have your first name, please?
Sure, my first name is Ellie. Also, I'm wondering, is the clinic next to Woolworths?
That's right, we're right across the road from Woolworths. What's your last name, please?
Not, N-O-T-T.
Thanks, Ellie. What's your date of birth?
6th of February 89. And Jess, can I also ask your opening hours, please?
We're open every day from 7 a.m. till 7 p.m. What's the best mobile phone number to contact you on?
0423 247 643. And Jess, do you bulk bill for tomorrow's visit?
Yes, we're a fully bulk billing clinic, so your consult will be fully covered by Medicare. I'll just confirm your details before I book. Ellie Knott, date of birth 6th of February 1989, mobile 0423 247 643, and an in-person general consult for a sore throat with Dr. Emily Carter tomorrow at 9:10 in the morning. Is that all correct?
That's correct. Thank you, Jess.
Perfect. I've booked you in with Dr. Emily Carter for tomorrow at 9:10 in the morning for an in-person general consult. If your symptoms get significantly worse today, or you develop trouble breathing, chest pain, or feel faint, please seek urgent help and call 000. Would you like me to help with anything else?
No,
like
Jess.
changing or...
No, that's okay. You have a great afternoon. Thank you again.
Now, some providers also offer outbound AI calls, which means that you can automatically reschedule patient appointments if a clinician's sick, you can automate recalls, share test results, or contact patients who are eligible for care plans. MediQo is currently developing this tool, and it will be released in the next 12 weeks. And based on client feedback, MediQo's recently implemented a blacklist function for patients that have been barred by the clinic. This means that AI reception will not allow these patients to book an appointment. You can also set the hours that the AI receptionist can book, so you can reserve time blocks for walk-ins or same-day appointments in specific scenarios. Now here's the practice manager or practice principal dashboard within MediQo. This will show your AI receptionist statistics, including total calls, new patients booked, total minutes used, existing patient appointments booked, and cancelled appointments. It also includes call summaries, so you can track the content of the conversation and then use that information to supplement the knowledge base and provide additional information for your AI to handle queries that are specific to your clinic. Now let's have a look at the Heidi AI reception demo.
Before we begin, can I start with your name?
Hi, I'm Ellie.
Hi, Ellie. I'm Heidi, your digital care partner who can help manage everyday care so nothing slips through the cracks. I can help you schedule appointments or request a script refill. What would you like me to do?
Can I request an appointment, please?
I'm not sure I understood that properly. Could you tell me again?
Could I have an appointment, please?
Can I grab your date of birth?
Sure, 6th of February, 1989.
Do you have a preferred doctor, or is any doctor okay?
Dr. Smith?
Which doctor would you like to see?
Dr. Smith, please?
I'm sorry, I don't see a Dr. Smith in our system. The doctors available are Dr. Bob Dillon, Dr. Amira Shah, and Dr. Michael Tan. Would you like to choose one of them, or is any doctor okay?
Have you got a female doctor?
I'm sorry, I don't have information about an email for any of our doctors.
No.
Would you like to choose one of the available doctors, or is any doctor okay for your appointment?
Do you have a female doctor?
Yes, Dr. Amira Shah is a female doctor. Would you like to see her, or is any doctor okay?
Now let's have a listen to Fashir's AI receptionist.
Good morning, Fashira Medical. How can I help you?
Hi, I'd like to book an appointment with a GP, please.
Sure. May I take your full name and date of birth?
Yes, it's Max Johnston, and my date of birth is the 12th of January 2000.
Thank you. When were you wanting to see a doctor?
As soon as possible.
Now if you want the AI reception to have an Australian accent, choose a tool that can. Let's look at some feature considerations. So some providers offer inbound calls, some will offer outbound calls. There's going to be differing levels of customization between the platforms, whether that's voices, greetings, hours, and exclusions, for example, the patient blacklist. It's important to make sure that the AI reception integrates with the practice management system that you're using. Beware of accents used, and also beware of time lags, because these sort of delays can jeopardize a patient experience and increase cost. Make sure to check all features thoroughly and test everything. In MediQo, you're able to see your calendar. This syncs directly with the practice management system. You're able to see whether the patient is a new patient or existing patient. You can see if it's an in-person appointment or a telehealth consult. You can see the appointment time and even how long they've been sitting in the waiting room. And with MediQo, you can also see the payment status as well as the amount of revenue generated from each consult. Once your appointment's booked in MediQo and you're ready to start the consult, you can select the location of the visit as well as the consult type. Now you'll notice that on the right-hand side of the screen there's a history at a glance. This is a summary of the previous 5 visits that this patient has had, as well as the treatment plan for each condition. Now this allows the practitioner to get up to speed quickly prior to the appointment. You can also access the history at a glance from within the consult at any time. In MediQo, you can start a telehealth consult inside the platform. Now remember, this is built on Fire and HL7, so it's very secure. It's not like using Zoom or an iPhone to deliver clinical care. Now at the moment, MediQo appears to be the only AI provider that is offering secure telehealth within the platform. AI can record the audio captured within your consults to provide automated and accurate clinical notes in the style and format of your choosing. So here we have some generated SOAP notes, but you can see on the left side of the screen that you can choose any of the templates available. This means you're not blocking out time in your calendar to complete your notes after an appointment. You're able to see more patients in a day, which essentially equates to more money for the clinician and more money for the clinic. This also has a positive flow-on effect for patients, as more appointment availability means shorter wait times when patients need to book an appointment. Now let's have a look at notes in Heidi. So a couple things to watch out for are accuracy of patient names, doctor names, and medication names, as well as potential missing information. The clinician's ultimately responsible for their notes, so it's really important that no matter what platform you choose, that you check thoroughly before sending them across to your patient management system. Now let's have a look at notes in Lyrebird. So we'll just scroll down here and see the plan, as well as on the right hand side of the screen. So in this instance, the demo patient has lower back pain, yet the AI is suggesting that the clinician looks at creating an asthma action plan. There is no patient history or context because this is a new patient in their first visit. So it's really just important to make sure that the tools that you're considering don't have any hallucination. And now let's have a look at notes in MBS Pro. Now you can see there's a similar sort of format. Each one has their own nuances, but all of the information's here. And we also have iScribe notes. So with iScribe, you have the dictation and then you click generate and that will generate your medical notes. So I'll just watch this as it's generating. And you can maximize to expand and see everything that's there. Within MediQo, you're able to generate care plans by simply clicking on the care plan section. Within MediQo, you're able to generate care plans by simply clicking on the care plan section on the left-hand side of the screen. This will use the audio that's gathered within the console to create a comprehensive care plan in the most up-to-date template required by Medicare. You don't have to spend a heap of time doing it manually and worrying whether or not you've missed anything. Now you'll see the suggested MBS item numbers at the top, followed by patient details and a fully populated GP chronic condition management plan below. You can refresh the care plan at any time using the icon at the top if more information has been shared in the consult that's relevant and should be included. And you can click to edit any of the content at any time. And here we have how to do a care plan within Heidi. So you ask the AI to do it, and sometimes it can take a little moment for it to generate. Now some care plans will be generated in a note style without Medicare approved formatting, so this means that you may have to spend additional time editing. We also have care plans in MBS Pro. So you ask it to create and then choose the initial. And create care plan. Again, different tools will have different levels of time that it takes to generate the care plans. Still waiting for it to generate, and much like Heidi, I can see that this hasn't been generated in a Medicare compliant format, so you will have to go back and spend more time changing the formatting to be compliant. And there we have the care plan. Now in MediQo, for our GP users or clinicians that claim through Medicare, MBS suggestions will surface for you automatically. In side-by-side comparisons, MediQo's MBS suggestions have shown to be the most accurate, and RACGP have stated that 20 to 30% of medical practices are underbilling. So this feature means that you're being paid fairly for the care that you provide. MediQo will link directly to MBS Online, and it allows you to see the specific information for those item numbers. And now here's an example of how the MBS billing suggestions work within MBS Pro. So you have to manually ask it to check compliance, and as you can see, the chronic condition management plan that has been generated is not compliant. Now back to MediQo, we've got a PDF form filler. If you have forms to fill, you no longer have to do it by hand. These forms are auto-filled from the information that's gathered within the consult. You're able to edit anything if needed, and you don't have to worry about whether your handwriting's legible or not. Lyrebird does also appear to have a PDF filler. Unfortunately, in our testing, we weren't able to get this to work. And back to MediQo, we have a clinical assistant. So if you have any clinical questions, you no longer have to turn to textbooks or Google. You can ask MediQo's AI assistant within the platform, and it will surface answers based on the patient context with all information from verified Australian clinical sources. There's also Heidi evidence. So in Heidi evidence, you choose your preferences in your region, and then you choose where you would like the evidence to be drawn from. Again, it looks to be a really good tool, but there is still a lot of things that you have to do, and it's not so much automated. So it searches for information. It says thought for 2 seconds, but it is still thinking. And you have some key points as well as some references. So in MediQo, you can also use differential analysis. This will allow the AI to analyse the data and then cross-reference with Australian clinical guidelines to surface suggestions that are relevant to the clinical context. So as you can see, you've got differential analysis, as well as the probability, key features and signs, and initial management in alignment with Australian clinical guidelines. This is all editable at any time. Now, AI tools also allow you to automate writing referral letters. So with MediQo, you can select a specialty type, and the letter will only include information that's relevant to that specialty. So if you're treating multiple complaints, only the relevant details will be captured and written in a way that makes sense for the specialist. This is also editable at any time. When you're happy with that, you just click Add a Referral Letter. And you can create another referral letter very quickly. There are also referral letters in Heidi. So we could write a referral letter to a rheumatologist. Now, one thing to note is MediQo doesn't use a letter template, whereas some of the others do. Now, this is because best practice or the patient management system that you're using will typically have their own letter templates involved. So you copy the information across and you don't have to remove part of the letter. And here is how you write a referral letter in Lyrebird. And here is how you generate referral letters in Lyrebird. And this is how you generate referral letters in MBS Pro. So you select the referral type and choose the discipline. And give it a couple moments to refer. Now, some referral letters can take a moment to generate. There's also iScribe. Now, you'll notice that referral letters are a little bit different in iScribe, and that's because iScribe appears to be designed for specialists. Their templates are quite different to what you'd use in a GP setting. Now, back to MediQo. You can automate writing patient or client education letters, so they're not leaving your clinic worried and uninformed. You just click patient education letter on the left-hand side and it will generate a comprehensive letter that's relevant to the patient. So if you've mentioned a medication in the console, it will bring up the side effects automatically as well as lifestyle advice that's relevant to that patient. Now back to Heidi. Similar to the other note generation, you do have to prompt most things. And so we've asked for a patient education letter here. We'll allow it to analyze the transcript and create. So they call it a patient explainer letter. So here it has the 3 topics that were discussed as well as next steps. general diet and exercise that could benefit this patient, and it doesn't mention any medications or provide red flags or potential side effects. And now we'll create a patient education letter within Lyrebird. So much the same as the Heidi letter, it's not surfacing information that's relevant to clinical guidelines to supplement the information that you're already providing to your patient, and it is sort of just a summary of the appointment that you've had. Now here's MBS Pro. So again, here it looks like we're calling it a patient summary rather than a patient education letter. And we'll let that generate. So it generates the patient summary report. And as you can see, MBS Pro does have the medications that were discussed, as well as possible side effects and lifestyle measures, and a personal action plan for the patient. We'll just scroll down here to show the rest of the letter. And finally, here is a patient education letter in iScribe. So today we've looked at a lot of tools together. Not all providers offer all features. Now obviously this is an area of fast innovation and things are changing all the time. What I would leave you with is the fewest possible providers that you can have equals the lowest cost, less training, and the easiest for your staff or yourself to navigate. My advice would be to find a platform that can do everything that you need it to do, both now and in the future, as it's better to have one AI tool that can do everything you need than have a whole bunch of different tools where you have to pay for multiple tools and having to train your doctors on a heap of different systems. Another thing to make sure of is that the tools that you're considering can integrate with your practice management system. MediQo is currently in the final stages of the integration process with Medical Director and actively working on integration with the rest that you see that have red marks on the screen. The others may be in process of integration also. You would just have to ask them to know for sure. Full disclaimer, this may not be accurate as this stuff is changing all the time. If you are with a different software provider, ask the question. And let's talk about some pricing comparisons. So we've got a table here comparing pricing of the different tools. Now, what you'll notice is that the table does show a comparative price for AI tools only, and it doesn't include AI receptionists. Unfortunately, most providers don't provide transparent information about AI receptionist pricing. Among the different providers, there is very, very different pricing. What I can see is that MediQo and Heidi are the most cost effective when you consider all features and integrations, as well as security. And what we've shown you here is a comparison of the per practitioner pricing. With MediQo, you do also have the option for clinic-wide pricing, including AI receptionist and unlimited usage of the AI tools for as little as $499 per month. There is no publicly available information about Heidi, MBS Pro, Fashira, or CareGP's AI receptionist pricing at the moment. Now we have security comparisons, so what I'll do is I'll pass you over to cybersecurity expert Berard Izadi to run through this information with you.
No worries, thanks, Matt. So I'll keep it very brief and not technical. There are some compliances, as you can see on the screen, which is each one has some information which is provided about the platform itself. So as you can see, the encryption and Australian hosting is covering all of the platform that we've tested. One of the very important features that MediQo builds on top of that is HL7 FHIR or FHIR, which is global standard for health. It's obligated in a lot of countries and is coming to Australia as well. So it is important when you choose a platform, making sure FHIR standards are supported. Based on our tests, obviously MediQo is built on top of FHIR, but Lyrebird has some level of support of FHIR as well. The other platform, they don't. That technically means when the new technology is introduced in health environments, it's standardized through the FHIR, and also it is secure by design. There are some other compliances like SOC 2 and ISO 27001, which is MediQo, Heidi, and Liebert supports that. These are the standards for how medical information or patient information are handled within your clinic or a cloud environment. So when you look at the product you are checking to buy, it is important to make sure all the information of whether it's the patient information or the practitioner information or clinical information are all secure within the Australian shore, as well as compliant with SOC 2 and ISO 27001. One more thing that I want to mention is about the AI models itself. So there are platforms out there. I would say most of the platform, they are wrappers around ChatGPT. So that means a lot of these AI models are using third-party AI companies like OpenAI, which is a provider of ChatGPT, or Anthropic, which is provider of the cloud models, which is we use on everyday utilization. So that means when they integrate the AI models into their platform, they are sending the clinical information to, let's say, OpenAI or the other third-party environment to process and come back with the results or the answers. Same as the information or the work that you're dealing with ChatGPT every day. When you go and try to buy an AI application, whether it's receptionist or the scribe tool or anything around the AI, it is important to ask the question, where are this model hosted and who are the providers of the models? Obviously, I cannot speak about the other platforms, but in MediQo, these AI models is built in-house for MediQo and deployed into our private environment, which is hosted by Microsoft. They don't have access to it, and MediQo and the clinics is the only one has access to this AI model. So these are the layers of the AI model training. To summarize, I think it is important to make sure asking the question about the hosting of the model and the ownership of the data that you provide to these AI models. In the enterprise version of MediQo, we do have option to deploy the whole package of MediQo privately for a private hospital or private clinics, which is no one else has access to and can use this AI model. So this totally private. So that's also about what right models to choose from. One last point that I want to mention about the security of the platform is the PII standards, which is technically means when the information of a scribe or a receptionist, AI receptionist, has been handled, it is important to make sure the information saved or hosted are redact for the personal information or identify personal information. This is another important part, which is we make sure in MediQo we do not save any information which is personally identifiable. And that's part of the FHIR or FIRE HL7 standards. The last thing is also about the receptionist. When you are calling that receptionist as a patient and dealing with that AI receptionist to book an appointment, manage the appointment, it is important to understand where this voice or the recorded voice are being hosted and saved and processed. These are the important parts that I would say when you are choosing an AI platform, it's important to consider that. Having an end-to-end platform, it means that it's less hassle for clinics to understand each individual AI models, and they don't really need to get into the complexity of each single technical distribution of those. So my suggestion would be choose a platform that you can validate and ask question about, and is there all with the support of most of your clinical needs, which could be a scribe tool or a AI agent or document sorting or whatever. So if you are dealing with one package, your validation of AI models is going to be applied. If you are going to for multiple packages or applications, that means that you need to consider each individual application's security and compliance.
Thanks, Barrett.
Oh, no, good.
So we'll also hand over to Dr. Riaz to have a bit of information about AI quality assurance.
Thanks, Matt. I'm Riaz Hashemi, a general practitioner and also Chief Medical Officer of MediQo. And I want to share my own experience of reviewing and comparing AI tools in healthcare. In my view, quality assurance is not just about whether a tool works, but whether it's safe, it's accurate, compliant, and practical in day-to-day clinical use. When I compare AI products, there are few key things I always look at. First, beware of AI scribe that have hallucinations. All data must be factual and legally defensible. And we need to be careful about hallucinations. AI scribes can sometimes produce information that sounds correct, but is actually wrong. So we always need to check the notes carefully. We also need to be careful about medication names and dosages, because even small mistakes in this area can be very important. And my observation, in some tools, you see this error more frequently. Second, some AI tools require longer waiting times for generation. And in a busy clinic, even small delays can reflect workflow and add pressure. So speed does matter. That's one of the reasons that we're using AI, isn't it? Third, some documentation is not in Medicare compliant formats. A note may look polished, but if it doesn't meet Medicare requirements, it can create problems for the doctor, especially in the case of an audit. For example, if a care plan doesn't come in a standard GP chronic care management plan template, you may need to copy and paste the relevant sections into your clinical software. That can be time-consuming, and sometimes it's actually quicker just to type it yourself. So the question is not only whether the AI can generate a document, but whether it gives you something practical and ready to use. The same applies to MBS item numbers. So AI can suggest billing items, but if it doesn't understand the context of the consult and just work based on keywords, then it's not always accurate. So this is especially important for less familiar item numbers, such as some telehealth item numbers. AI can be helpful as a guide or learning tool, but it should support your judgment, not replace it. Another important point is ambient listening. Some AI tools keep the microphone on all the time, while others only activate it during the consultation. That difference matters for privacy and security. If the microphone is always on, it can raise concern about what's being captured and when's being captured, before the consultation, during the consultation, after the consultation, and why it's being captured when I'm not using the tool. AI can be helpful, but we also need to trust them as well. So tools that only activate during the consult may offer more control and reassurance for both doctors and patients. Customization is also very important. Some platforms have limited customization, and that can limit workflows. So we should be able to customize our notes or referrals or letters, management plans, and also at the clinic level, when we want to implement AI receptionists in our clinic, we need to ask these questions first. Can I add doctors? Can I remove a doctor? Can I change a working hour or fees? Can I blacklist a patient and always redirect it to a receptionist? Can I set up complex bookings, like a booking with nurse first for pre-assessment and with the doctor, or health assessment 45 minutes with nurse, and then 30 minutes with doctor, and so on? And can I do all of these things on my own? Or I need always ask the support team of the platform to help me with that. They're able to do that. So if the answer is I need to contact support team for every single change, then actually we're always behind, and it's not practical. And also, finally, the accent of the AI receptionist. So ensure AI receptionists have Australian accent, not my accent or American accent. It may seem like a small detail, but it makes a difference to trust and patient experience. So overall, AI can be a very helpful tool, and I would absolutely encourage everyone to use it. But we should use it in a smart and safe way. The key questions are, is it accurate? Is it compliant? Is it secure? Did it save me time? Did I learn something new? Do I feel more confident? Do I feel less stressed? If the answer is yes, then this is a right tool for your daily practice. If the answer is no, then probably you need another AI tool. Thank you, everyone, and back to Katrina.
Wonderful. That's a lot, right? That's a lot of information. If you're feeling overwhelmed, I imagine you're very normal. Please know you will all get a copy of the recording. You'll get a copy of the slides and be able to look at those comparison slides. And the security slides, I would recommend you. And I remember when we first started comparing all of the medical software, I had a spreadsheet and I'd be which one has which features. This is going to change just constantly. So I'm not going to hold you up any longer. It's time for you to go. I just wanted to leave you with that. Okay, what do you do from here? So your next steps, I hope you chose your pain point. Feel free to write it in the chat what your biggest pain point is, whether it's time with the patient, whether it's clinical note taking, whether it's being able to answer the phone, the telehealth aspect. I think there's a lot of benefits to be gained with these features, but you define your needs and your goals. Talk to people. As a patient, I've been using AI tools with doctors recently. I had COVID as a patient. Fascinating. I love the summary that you get. I'm looking for missing and inaccurate information. So we're studying it. We're doing our due diligence. And then ask people how they feel about it. How did the patients find that experience? What were the pros? What were the cons? How can we do better is a question we should always be asking, right? And then prepare your workflows for your practice, train your staff, bring everyone along with you on this journey. And then, try a few products, review them, and then monitor. Did we save time? Did we save money? Did we improve the experience for patients? Monitor the outcomes, measure them, and then if you like it, embed that change. So that's it from me. Please feel free to reach out to me at any time. I do have a 3-hour AI literacy for healthcare practices e-learning course, and I have a coupon code. It's not Katrina, it's MediQo. Reach out to me at any time, and I strongly encourage you to do a demo with Matt and get all your questions answered. And we look forward to seeing you again soon.